Welcome back. I'm now joined by Dr. Allan Simpson. Welcome to Canterbury Live, Dr. Simpson. How are you today?
Good, thank you.
Excellent. And now we're here to talk about glaucoma. And for those of us that may not know exactly what that is, can you explain to us?
Well, it's a disease of the eye that affects the optic nerve at the back of the eye, causes typical structural changes and consequently visual field loss. So you lose peripheral vision from your eye gradually and insidiously and relentlessly over a long period of time if it's not picked up. And if you think of the optic nerve as being the connection between a digital camera and a computer, and there's a million nerve fibres in that optic nerve you're born with, gradually in this condition, glaucoma, they drop out and you lose more and more of them, and your visual field and your vision suffers as a result of that transmission defect that the optic nerve damage causes.
That's a great way to describe it, really. Why do they call it the silent thief of sight?
Because it creeps up on people without them realising it's happening. There's no real symptoms, there's no pain, and until quite late in the disease process, when you might notice half your visual field is missing, people might not know they've got it. They've still got good central vision, so they don't realise when they do a Snellen chart, a visual acuity letters test, that there's anything wrong with the vision, because it's peripheral vision, roundabout vision that's affected first. Later on, central vision can be, but often half of it's gone in one eye and then the second eye starting as well before people know it's happening.
So is it really only at the point where maybe they're going in for a checkup or getting a new pair of glasses that it could be detected?
Certainly. In fact, that is the prime time to have it picked up. When typically we all need reading glasses at the age of about 45. And that is a good time to get a checkup, because that's when glaucoma really starts happening. If it's going to happen, it'll be after age 45, and you don't want to miss that opportunity of having an eye checkup as well when you get your glasses.
Do you need to go to a specialist, or can you go to like your normal person?
You should go to an optometrist for that indication, and optometrists are very good at screening for and looking for glaucoma and picking it up and referring on when necessary. So certainly the optometrist is the person to see for those spectacle requirements, and also that screening for eye disease, including glaucoma.
How are we faring in New Zealand then for glaucoma?
No better or worse than other developed countries. We do have about 68,000 people with glaucoma is the calculated number in New Zealand over the age of 45. And the problem, of course, is that maybe half of those people don't know they've got it. So we would like to know about those people and pick it up and start treatment.
In a perfect world, would you love it that it was actually free testing?
Yes and no. It doesn't stack up as a population-based screening test, because the diagnosis requires too many tests. It's not a simple yes-no kind of answer you can get from that. And the cost effectivity of screening populations just isn't there. So we really do rely on things like this Glaucoma Awareness Month, and people knowing about glaucoma and hearing about it from family and friends particularly, and hearing that advice from Glaucoma New Zealand to get that check-up at age of 45 and 5 years, every 5 years thereafter. So that's quite an important part of detection and picking up those early cases.
So take us through it. We have a test, and then unfortunately we do have the news that we do have glaucoma. What is the next stage? What is the next point for that person?
Well, that test will typically involve measuring pressure in the eye, because it's usually elevated, although not always, and measuring the optic nerve head appearance and structure, and measuring the visual field in both eyes, and deciding if that's glaucoma or not. And then the treatment is all about lowering pressure. Often the pressure is high to start with, higher than it should be, and we lower pressure. If it's high normal to start with, we lower it to low normal. But all we can do about glaucoma is lower pressure. But it will be a matter of recording all those baseline measurements, so we've got some point to monitor from in future to prevent that getting worse. And then starting usually eye drops to lower pressure. We have a good range of eye drops that lower pressure effectively, and often will suffice for many years to control pressure. Otherwise there is laser treatment or sometimes surgery also necessary to control the pressure to a sufficient level to stop that ongoing progression of damage.
What is the biggest message you want to get out of this month with glaucoma?
I think the biggest message is that get a proper check-up of your eyes at the time you need your glasses. Don't go and get a simple pair of hobby specs that you can buy off the shelf. Nothing wrong with them in themselves, but you're missing that prime opportunity to have a good check-up. And the Glaucoma New Zealand general advice is that over the age of 45, every 5 years you should have a general eye check by an optometrist is fine, and after the age of 60, every 3 years. If you have family history or one or two other risk factors on top of that, then that might be more frequently that you should have those follow-ups, but by and large, without those, and just on the general population basis, that's the advice.
Should we be all savvy and talk to our family members that are
Yes.
that don't make the effort?
And
Thank you very much.
Yes, indeed.
Wonderful. Thanks, Dr. Simpson. And if you want to find out more, the website is glaucoma.org.nz. Now, in May, we met a lovely, lovely lady, hairdresser Karen Haas. Now, remember, she is raising money and will be shaving her hair off tomorrow night, 6 o'clock at Sutherland Todd Hairdressing in Maryvale. There's auctions, there's raffles, just go along. And there's her Facebook page, facebook.com. You can see it right there. So make sure you go along. We'll see her on Monday. Now, we take a look at Loose Lips episode from tonight. Thank you for joining me. See you tomorrow.